Good morning, DBS family. The weather for the past week may have you wanting to be under the sheets, but don't worry, we are here to bring the sunshine here at DBS this morning. I am Mona Lisa.
And I am Alison Monrose. We're not only here to bring the sunshine, but we're also here to shine light on important issues affecting us. But before we get right into that, let's check out the morning news highlights.
Good morning. Former Health Minister Mary Isaac is calling the government's decision to return to the old St. Jude Hospital site questionable. She claims that multiple reports during her tenure as minister indicated that the old structure was unsuitable for a hospital operation.
It is very sad that after so many years since the fire, that here we are today. A child born that year would be a teenager this year. And we are still here grappling with the fact that throughout so many different administrations, we have not been able to deliver a new hospital in the south to replace St. Jude Hospital. The nurses, the workers who were temporarily removed from the old St. Jude Hospital are still in that old facility where they were placed, the stadium. And we know that the stadium is in a very deplorable condition. When we came into office, we had to remove all the shingles up top. We had to retrofit. We had to do a lot of renovation and maintenance of that old structure. Also, we have deprived the young people of this country of this sporting facility for the past 13 years.
Prime Minister Philip J. Pierre, you will remember, indicated that work would recommence on the old St. Jude structure in November of 2022, starting with the site's fencing and other exterior works. A knee-jerk reaction by the government is how opposition Senator Dominic Fedee is describing potholing work done along a section of the Julian Hunt Highway on Wednesday afternoon during rush hour. The closure of that section of the highway without prior notice left motorists stuck and fuming in traffic for hours.
It was intriguing yesterday to see what can only be described as a knee-jerk reaction by the government. In the middle of rush hour, as commuters going from the city center to the north would have met the road, the shock highway, closed, unannounced by the Ministry of Infrastructure. Now, it leaves us to wonder here in the opposition whether the prayers on Facebook, which said, as I drive through the valley of potholes, imagine that the deterioration of our roads have reached to that state where people are now creating pekings and memes about the ability and capacity of our state institutions.
According to the Ministry of Infrastructure, with the weather having let up, the ministry profited the opportunity to conduct the work. Senator Fedee, however, says the SLP administration's excuses are unacceptable. Physician Sylvia Wilson has welcomed recent announcements by the Ministry of Health about strides being made toward providing universal health coverage to citizens, voicing her support for an affordable rate being paid by citizens in exchange for quality health care.
I think, first of all, our people must recognize that getting everything, we have to pay for it. If we have to have a service like Martinique next door, the Martinicans pay for the health care.
It's also subsidized by France.
Yes,
right?
Right. But you pay a level of taxation from your salary and so on towards healthcare. Okay? So, because I worked in St. Martin and I know. So, the French people do
Stay
pay
with us. We'll be right
a level
back.
of taxation, and that goes towards health insurance.
Cabinet has approved the first phase of the implementation of universal health coverage, which will commence with the performance-based financing component. In the coming weeks, a series of consultations will be held with the private sector, non-governmental organizations, and client group stakeholders. The Daniel Riviere Combined School is celebrating its 50th anniversary this week.
She was supposed to be here with us today, but because of her condition, she's unable, and she would have really been unable to sit here to last this period. But we took the time out as Den Yerbia Combined, along with a team of teachers, past students, and we went to her house on Sunday. We spent some time with her, and we honored her. And she was indeed very, very pleased.
As part of the observances, a tribute or special tributes are being paid to the many teachers who have served the school over the years. And those are your top stories. Thanks for watching. Good morning.
We'll be right back, so stay with us.
Thanks for staying with us. We continue our conversation with Dr. Tamara Remy.
Today, the St. Lucia Cancer Society has joined the global movement of Going Gold for Childhood Cancer. Dr. Remy tells us more about the initiative.
We don't usually think that cancers affect children. And I think that's the first point that needs to be established, that while the majority of cancers occur in adults, we do have cancers in childhood. Number one, they present very differently. And more importantly, there's really very little you can do to prevent them, right? So in adults, we speak about environmental factors, we talk about healthy lifestyles. But in children, where we talk about, we consider kids under the age of 1, they haven't been exposed to the environment for very long, and they're getting cancers. So a lot of times it's something that's genetic, something that is already in their cells, in their DNA, a mutation or something that has happened that predisposes them to getting cancer at a very early age. So in St. Lucia, our figures are probably maybe 1 to 2, sometimes 3 to 4 cases per year. And apart from the difference in terms of the presentation and the causes, we don't have very much experience in dealing with childhood cancers, and so therefore a lot of our patients are actually referred outside of St. Lucia for treatment. So last year we probably saw about 3 or 4 cancers in children, and the most common that we see are leukemias. Those are blood cancers, the acute leukemias. And we also see cases of neuroblastomas, which are cancers that occur in immature nerve cells, which can occur anywhere in the body. So we refer our patients, and last year the Cancer Society assisted with transporting 3 kids to Martinique so that they could get their treatment at least started there. We do have associations that we work with. That's St. Lucia in general. Sick Kids Initiative, which is based in Canada, I believe, that we have an ongoing relationship, we contribute with, where we can refer patients. They also contribute to, or we contribute to their registry where they collect the data, etc. for patients in St. Lucia. Inherited suggests for me that it may be something that's passed on, so that there's a family history, but not necessarily so. We're talking about abnormalities that occur in the cells, and the kids are already born with that abnormality. So it doesn't take very much for something else to happen for the cancer to manifest. The other important difference between children's cancers and adult cancers is that our kids do really well once they get the treatment that's required. Adults, you tend to have a lot more variation in outcomes, one dependent on the stage or how advanced the disease is, but with children, they tend to respond very, very, very well to treatments. And so I think the onus is on us to bring that awareness. Number one, get people to understand that your child may have a cancer. It may not be the cancers that we talk about all the time, breast cancers, colon cancers, and the signs and symptoms that we should really be looking out for, which are not always very specific. So if your child is more tired than usual, if they're complaining of blurred vision, if they're having headaches, vomiting, if you see a lump that appears in a strange place, there's no history of any trauma or a blow or anything like that, you really should be taking the kids to the doctor, getting an opinion. The very specific things, for example, if you look into your child's eyes and you see that the part that should be black is white, then that's also a sign. So the symptoms may not be specific, or a breast lump, things like that, but you just need to be aware of changes that are occurring in the child. Simple things as well, like easy bruising. They fall and they have this massive bruise on the leg that's taking a long time to disappear. Something like that may be a sign that something else is going on, especially with the leukemias. So we usually the pediatricians will contact us. Usually the diagnosis is made in hospital, and they will contact us, and our main contribution is, as urgently as possible, transporting these kids away. The pediatricians do a really good job because they have their network in terms of who to refer the patients to and how that system works, and it's usually complemented by the Ministry of Health, where they can assist. Luckily for us, Martinique has always been a partner. So once we have kids who have a cancer, which they consider for the most part something that's curable or something that can be treated, they will accept the patients, they will initiate treatments, and we can owe them. I don't want to say that too publicly, but Martinique has really, really helped us with that. In terms of support, we have a support group, Pillars of Hope. Most of the members are cancer survivors themselves, but we do have family and supporters or friends of cancer patients. So that's always open to patients or their relatives. But remember, this is a different dynamic. It's a different group of kids, and most times when they get older, they don't even remember what they've been through. Some will tell you that they can remember every single detail, and in our webinars that we've had in the past, we've had survivors who are like in their 20s and 30s talking about their experiences and what they remember about the journey. The numerous injections and losing all their hair, being even bullied at school because they didn't have hair. So it's different in terms of the support. I think the parental support, the ability of parents and close family to be with them as they go through the journey is also important. So wherever we can, we will assist with transportation or airline costs to facilitate that. Sometimes, as in the past, we've helped with accommodation for relatives so that they can be with the child as they go through the treatment. So our role really is trying to facilitate getting patients to the facilities that they need to be in, and as much as possible making sure that they're accompanied and working closely with the pediatricians, etc., in whichever other way that we can.
Thanks for staying with us. We continue our conversation with Dr. Tamara Remy.
Today, the St. Lucia Cancer Society has joined the global movement of Going Gold for Childhood Cancer. Dr. Remy tells us more about the initiative.
So the appeal really is to individuals, to schools, to companies, to institutions, even to the hospital, that in recognition of Childhood Cancer Awareness Month, which has been September, that we all wear something gold. You can wear gold jewelry if you're accustomed to wearing something else. You can wear a gold ribbon. You can wear, do your nails in gold. You can wear socks. Anything that brings attention to what it is we're trying to achieve here. And we're just hoping that persons will join us. You could even tag us on our social media handles just so that we know that you're part of the process. And we're kind of continuing from where Melissa Rivers, has been working. She lost her son, Kamar, and I think it's 5 years now. And we have been supporting her from we were aware of her campaign. So Still Standing with Kamar is a non-profit organization, a fund in his honor. And they try to assist wherever it is that they can. I believe that this year has been very difficult for her. and I made a promise that we would continue that. So in the previous years, they have picked one Friday or one day in September and encouraged everybody to go gold, and we just wanted to continue that recognition and support. So this year, we're really appealing. We've engaged the Ministry of Education, the Ministry of Health, just to disseminate the information to the various schools. The schools can make it exciting. You know, if we had a little, maybe next year we can talk about getting art in gold and letting the kids design their own shirts or doing something different as you go from primary to secondary schools. Their understanding of childhood cancers, raising hope, raising awareness. So the schools can actually do things like encouraging the kids to wear something gold, where there's gold ribbons in their hair, gold socks. We can probably provide some of the gold ribbons with the pins so that everybody's on the same page. We can even maybe do some donations, 25 cents, just in recognition, dress down. Anything that is thought of as being contributory, your awareness and your support is enough. But we will always accept financial donations and put that aside for any children who actually require treatment. A lot of people have thought that the Cancer Society, they don't hear very much about us. Our mandate really is to try to eliminate cancer in St. Lucia, and we believe that there are several ways to do this. Yes, there's the education and awareness. There's prevention, which personally I think is where a lot of our effort needs to be. And there is also early diagnosis, treatments, and how we provide support, whether it's emotional or financial support. So I think most people know us from the financial support that we actually provide. So we're not necessarily always in the news, and there's a role for other entities, for example, bringing free screening, free health fairs, etc. Our work really is trying to make sure that we set policy and ensure that in St. Lucia there is policy when it comes to cancer. So yes, we can join in with the health fairs, yes, we can do all of that, but when a patient is diagnosed with cancer, we want to ensure that the next steps, the pathway to treatment, the pathway to even just the diagnosis, that is uniformed, that we've eliminated the inequities and the inequalities that exist. It should not just be if you have money you can get treatment. So we are pushing for stuff like that, and at the same time pushing for prevention. So coupled in September is a return to school, it's childhood cancer awareness. We're embarking on campaigns that deal with healthy nutrition in schools, because what you eat is what you become and what you are. And if we have managed to prevent, for example, in this case, we've brought the awareness to you what to look out for childhood cancers. Your child has gone through that period, they did not get a childhood cancer. We now have to focus on making sure they don't get an adult cancer. And I believe, and I think the society also supports me when I say that we have to prevent in order to see the changes or the reduction in the numbers in the next 20 to 30 years. So our obesity in schools needs to be eliminated. We need to deal with that because an obese child becomes an obese adult. So the Cancer Society, we have this mandate that we need to fill. And what we're hoping to do is just to strengthen the policies, establish the policies. We collect all the data that's available. So when we talk about cancer, we're not just talking off the top of our heads. We actually have figures. So we always welcome members. It's a voluntary service. We do have a small membership fee that we require from our members just to keep the society going. But we want people to know that our work is never done. Unless cancer is eliminated, our work is just never done. So you may not see us out in the forefront, but we're doing a lot of work in the back. And we welcome all other entities who work alongside us or who are for dealing with cancer, bringing the awareness, etc. Because we can't do it by ourselves. It's a joint, collaborative effort. That's the only way that we're going to see a change.
Thank you so much. That's just our initial. morning and welcome to this morning's Soca Size session. Leading the wine, we have Laurie, Susie, and Shani. Let's get ready to sweat with Soca Size. This warm-up routine is Savannah Grass by Kes the Band. Let's get moving. 4, 3, 2, beat your steel pan or your piece of iron. 3, 2, alternate the side, step together, and hey. 4, 3, 2, take it, and we gon' make them jump, roll and wind, waist side to side, let's go. Now we're front line costumes, let's go, to the side, and take it back, and turn it, turn it, turn it. This side, let's go. Olado. Take it back. Turn it, turn it, turn it. 4, 3, 2, 1, and hey. 4, 3, 2, 1, take it up and wind, wind. With 4, 3, 2, let's go. Olado. Hey, hey, turn it. Next side, let's go. Turn it, turn it, turn it, turn it. 4, 3, 2, 1, and arms up. Wind. Wave on. 4, 3, 2, 1. That was this morning's session. Thank you for choosing to flaunt with Soca Size St. Lucia. Have a wonderful day.
Thank you so much for joining us on DBS this morning. Do not forget, wear your gold or your yellow today to support and to give awareness to childhood cancer. Children are important.
Indeed, although we're not wearing our gold, we're about to go and change. So don't look at us, just go and get ready and put on your gold and represent for childhood cancer. We hope that you have an amazing day and go and have an amazing weekend. We will see you on Tuesday.
Bye.